Hello, ladies and gentlemen. Welcome to this presentation. In this presentation, we are looking at the arterial blood gases. We will also explore the relationship between arterial blood gases and acid-base balances. At the end of this lecture, guys, we'll learn to know how to calculate and tell whether this is an acidosis or an alkalosis. But first, we start with defining what is an ABG, arterial blood gases. And arterial blood gases are simply a test that requires you take a blood sample from an artery and you measure the levels of the two major gases, oxygen and carbon dioxide in blood. So these ABGs, they do measure a number of components in blood, starting with partial pressure of oxygen, which is simply the amount of oxygen that lungs have to deliver to the blood, simply put as the oxygenation status of the body. On the other hand, partial pressure of carbon dioxide refers to the efficiency at which the lungs can eliminate carbon dioxide from the body, simply put as the ventilation status. pH, this one will be able to refer to or determine the acid base level of blood, and is based on hydrogen ions. So acidity will indicate that we have excess hydrogen ions, while alkalinity will indicate that we have a deficit of the hydrogen ions. Oxygen content, on the other hand, is the amount of oxygen in blood, while saturation or arterial oxygen saturation simply refers to the amount of oxygen in blood that is bound to hemoglobin that is being transported around the body. Finally, bicarbonate are simply anions, and they are chemical buffers that do keep the blood pH from becoming too acidic or too basic. So if you want it to be more acidic, we'll reduce the number of bicarbonates, while if you want a more as a basic environment, you increase the amount of the bicarbs. Remember, ABGs are the only objective data that we have around that can be used to determine if a client is hypoxic. We simply look at ABG, are they abnormal or within the normal range? Most most exams indicate or do ask about, you will find someone asking which is the best diagnostic test used to evaluate a patient oxygenation and ventilation after traumatic brain injury. The answer is simply the ABG test. Generally, these ABG tests are typically done by respiratory therapists. So, and the priority nurse intervention after withdrawing this blood is simply to apply pressure for about 5 minutes. Remember, we are puncturing the artery. Okay? What is the purpose of performing this test, guys? We want to evaluate the efficiency of pulmonary gas exchange. You know, the ABGs will measure the oxygen and carbon dioxide levels in the arterial blood, and this will provide insights into how well the lungs are exchanging these two gases. Number two is to assess the integrity of the ventilator control system. ABGs will help us evaluate the respiratory system's ability to regulate ventilation, detect issues with respiratory drive or neuromuscular function. Number three is to determine the acid base level of the blood. As you know, ABGs will provide information about pH, about bicarbs, about partial pressures of both carbon dioxide, and aiding in the diagnosis of these acid base balances, which are normally the root cause problems in many patients. Lastly, we want to monitor the respiratory therapy so as to we can use the ABGs to assess the effectiveness of these interventions, such as the mechanical ventilation, oxygen therapy, and this will help us carry out adjustment as we try to prioritize respiratory support. So when you are carrying out this ABG test, you are supposed to inform the patients about the test, talking about the purpose of the test so as at least to allay anxiety from the patient and to make the patient to at least be empowered by the knowledge. You have also to inform them about the potential discomfort during this procedure, and most patients Report to feel a brief pinch or a sting when the needle is inserted, as when someone is withdrawing the blood. Okay. Next, you have to obtain the consent. Obtaining the consent from the patient before proceeding the test is very key. Check the allergies. In some cases, people use local anesthetics, so you have to find out if the patient is allergic to these local anesthetics that are likely to be used. Also, explain the procedure to the patient, emphasizing the need for the patient to remain still and calm during the procedure. You have to check the vital signs, the baseline signs, including the heart rate, respiratory rate, BP, oxygen, so that they can be used to compare to the findings. You also verify the patient using at least two identifiers. We always prefer the name and the date of birth. This could vary among different hospitals based on the hospital policy and protocol. Also, learn to position the patient in a comfortable position, typically lying. Okay, a link will be popping up on how to position patients in different positions. Also, you could also warm the puncture site. If the site will be the radial artery, it's normally imprudent for you to warm the patient's hand by placing it in a warm towel for a few minutes. This is very key because it helps the blood vessels to dilate and makes this arterial puncture much easier. Then also apply the local anesthetics, the one that you have mentioned, based on the different healthcare providers, because some of them could apply a local anesthetic just to numb the puncture site so as to reduce pain during the procedure. So you do collect the sample and you perform arterial puncture to collect the sample. You remember you have to use a heparinized syringe so as to prevent clotting. After that, you have to immediately apply pressure, okay, for about 5 minutes. For that case, you monitor the patient for signs of complications, document the procedure. Then after the procedure, you have to continue observing the patient and instruct the patient to report any unusual symptoms. Remember, there is no dietary restriction for this process at all. The teaching points could include that, of course, when you are doing the teaching, you have to include both the patient's family and the caregiver in their teaching where appropriate, and of course, from the consent of the patient. So you explain to them the arterial blood gases analysis, how to evaluate, and how, so as for them to understand that this one will help them will help to evaluate how well the lungs are delivering oxygen to blood and how well they are also eliminating carbon dioxide from the body. Also explain to the patient the need to not restrict food or fluids because this is not involved in this case. You tell the patient that the test requires a blood sample, okay, so that they are sure of the type of sample to be used. You instruct the patient to breathe normally during the test. Warn the patients about that the patient may experience some pain, the one that you've said, like a sting, okay, as you insert the needle. So for those patients who are taking anticoagulants, aspirin, or any other supplements that could alter blood clotting, they have to report this to the healthcare provider. Explain who will perform this puncture. We have already said is the respiratory therapists, okay, and then where the puncture site will be. In most cases, it could be the radial, but sometimes you could go for the brachial and even the femoral artery. So you have to inform this that this patient that this procedure will take averagely 10 to 15 minutes. In terms of the procedure steps, you have first of all to confirm the patient identity using the two identifiers that you have mentioned. Then you perform hand hygiene and you put on gloves and wait for about 20 minutes before withdrawing arterial blood. You have to use heparinized blood gas syringe so as to prevent this blood from clotting, and then determine the optimal body location for the sample. If you have decided that is the artery, then for the radial artery, then you have to perform the Allen test, and the Allen test is normally performed so as to determine the patency of the ulnar artery. So it's done in 3 steps. The first one, you are supposed to ask the patient to make a fist, and then so in this case, the both radial and ulnar arteries will now be occluded then, okay, while the patient has clinched the feet tightly. So As you apply the pressure on the two arteries, you maintain the pressure, you will ask the patient to relax the hand. So they relax the hand now. Now you release the ulnar pressure and you maintain the pressure on the radial artery. And then you determine how long will it take for the normal color to be resumed. Averagely, in most patients, you find it will take around 15 seconds. Okay, in that case, you'll say that the ulna is patterned, so you are free to proceed and carry out the procedure. Remember to perform arterial puncture or draw blood from the arterial line and eliminate air from the sample appropriately. You label it, then immediately place it in the eyes and prepare to transport it for analysis. Before sending the sample, of course, you have to note the laboratory request form, whether the patient was breathing room air or receiving oxygen therapy when the sample was taken. You have to know the flow rate of oxygen therapy and the method of delivery if this patient was on that supporting machines. So if the patient is on a vent, also you know the fraction of inspired oxygen, tidal volume, mode, respiratory rate, positive end, which are very key in calculating also the values. After the procedure, we say that the first nurse responsibility is to apply a pressure to the puncture site for a minimum of 5 minutes or until bleeding stops, and then you can firmly tape a gauze pad over the puncture site. You can remove the gauze pad after an hour. If the patient has been on anticoagulants, you have to apply pressure at the puncture site for a minimum of 10 minutes because this takes longer for the blood to clot because of the anticoagulants. If the puncture site is on the arm, you do not tape the entire circumference of the limb because this will compromise the circulation to the distal parts. You have to monitor the vital signs and observe for signs of circulatory impairment such as swelling, discoloration, pain, numbness, and tingling in the bandaged arm or leg. Immediately you place this sample on the eyes, as we have said, and be aware that exposing this sample to the air can alter the results. Okay, so you have to maintain the standard precaution when performing this procedure and handling the sample. Possible complication: you could have thrombosis with the with distal ischemia, major hemorrhage, and aneurysms, nerve damage, and arteriovenous fistulas in both cases. So this one should at least help us to balance and look at now the acid-base balances. So these are just normal balances of the body acids and bases, and they are normally measured in pH. So blood is normally slightly basic with the normal pH values ranging between 7.35 to 7.45. So when the value is too low or below the 7.35, our bodies become acidotic. While when the values are too high, that's above 7.5, we say our bodies are alkalotic or the basic. So we have major players that help us maintain the acid-base balance, and one of it is the bicarb anions. So the bicarb ions, we say that the more bicarbonate anions you have, the more basic our bodies become. Remember, bicarb equals to base equals to someone being alkalotic and having an alkalotic condition. Number two player is carbon dioxide. The carbon oxide, guys, remember it normally combines with water to form a weak carbonic acid that can easily dissociate into those different elements. And you can see, so this one, the presence of this carbon dioxide, it means that our bodies are going to be more acidic from the word carbonic acid. Okay, so remember, carbon dioxide is an acid. The other component that also help or plays a big part is the hydrogen ions. Hydrogen ions are normally produced in the gastric mucosa and in urine. So remember, when you have more hydrogen ions, they'll make our bodies to be more acidic. So when you have more hydrogen ions, it means we have and more acid. So more acid makes our bodies to be more acidotic. So what happens to our bodies? What happens to our bodies to be acidotic? For you to be acidotic, it means you must have more hydrogen ions and or you have to have more carbon dioxide. In that case, you'll become acidotic. What about alkalotic? You'll need to have more bicarbonate ions. So ladies and gentlemen, we have two major body organs that normally help control the acid-base balance. These are the lungs and the kidneys. You will know that the lungs, they do control the carbon dioxide. Carbon dioxide, remember, it's forming carbonic acid, so it's forming as it causing acidosis. So how do lungs work? Know that a normal gas exchange will involve inhaling in oxygen and exhaling carbon dioxide. So if we breathe out, it means less CO2 if out. Okay. If we breathe in less, if breathe out less, okay, it means now more carbon dioxide is going to accumulate. Okay, so it's going to be retained. So it means our bodies are going to be acidotic because we have not released more carbon dioxide. Carbon dioxide has been retained. So remember, when you have more carbon dioxide being retained, it means we'll have more acid in the body. So this will form or create acidosis. Remember, conditions that can cause decreased or increased retaining of carbon dioxide is when you decrease your respiratory rate. When you start breathing slowly at a lower rate, it means you are not going to blow out more or enough carbon dioxide. So much of the carbon dioxide is going to remain in the body. So you'll be having a condition that we're referring as acidosis. Okay. Respiratory acidosis, we are saying, is a condition that normally occurs when the lungs can't remove all carbon dioxide produced by the body. So this causes the blood and the other body fluids to become too acidic. And we have some of the conditions that can lead to this problem, and we abbreviate them by the word breather. We have brain injuries, especially the head injury. Somebody is relaxed. We have extreme sleepiness, anesthetics, too much calmness, hypernation, extreme happiness, and rest and repose. That is resting deeply. This will make us, our body or our lungs, not to blow out more carbon dioxide. So we are going to retain more carbon dioxide, and when we retain more carbon dioxide, we become more acidic. Okay, that is what we have to know. On the other hand, if you have increased respiratory rate, it will lead to alkalosis. Okay, alkalosis, breathing at increased rate. Yeah, like the that means we are removing more carbon dioxide. So if we are removing more carbon dioxide, which is acidic, we are saying the condition will change to basic or alkalosis. And some of the conditions or circumstances that can cause such kind of case is, we can abbreviate it with breathe fast. That is break-taking moments, excitement, running, emotional stress, anxiety, too much caffeine, hyperventilating, exercise, feeling panicked, suffocating situations, terror. All these situations, you find that we are breathing out CO2 more rapidly. So we become less acidotic because CO2 is an acid, so we become less, and this result into respiratory alkalosis. So let's look at the kidneys. So they control the hydrogen and the bicarb ions. Remember, the kidneys have two main ways in which they can contribute or support the acid-base balance. First, they can help by their cells reabsorbing more bicarbonate from the urine back to the blood, and they also secrete more hydrogen ions to the urine. So those are the key roles that they do play. So kidneys usually secrete more hydrogens in urine, and when they do that, it means the body is becoming less acidic. Okay? Yes, because you're removing the hydrogen ions. Sometimes you by retaining bicarbs, it means you are helping the body to be more basic. So naturally the body is balancing these ions, secreting and inhibiting the release of these ions. So maintaining these ions at equilibrium is what is referred to as balancing out or compensation. So this is commonly referred to as finding a common ground of balance. Sometimes it can be fully or partially compensated. For example, the metabolic acidosis, for example. So metabolic acidosis, this is acidosis. Remember what causes acidosis? It's either carbon dioxide or hydrogen ions. Picture an example where somebody is undergoing diarrhea. It means they are going to remove excess bicarbs. And when you remove more bicarbs, you make the condition to be more acidic. Or renal failure, where the body fails to secrete hydrogen ions. So it means hydrogen ions are going to be retained. And when hydrogen ions are retained, it means the condition is going to be acidic because more acidic environment. And lastly is diabetic ketoacidosis. Even from the word diabetic ketoacidosis, you can also tell that it's creating an environment full of an acid, which is going to contribute to acidosis. So metabolic acidosis is controlled by hydrogen secreted in the stomach and urine. So renal failure, kidneys cannot secrete hydrogen ions as they used to, so more is retained, causing more acidic environment. Diarrhea is also a contributes or is another cause of metabolic acidosis by leading to loss of bicarbs by the bicarbs. The other conditions that can lead to metabolic acidosis are abbreviated using the mnemonic acid wash and could include alcohol excess, carbon monoxide poisoning, intense exercise, diabetes, ketoacidosis you have already mentioned, warfarin overdose, aspirin toxicity, sepsis, hereditary disorders like the lactic acidosis. In both cases, you find there is a formation of an acid which contribute to an acidic environment. What about the alkalosis? Alkalosis, a good activity that can lead to this condition is vomiting. When you vomit, what comes out? You're vomiting the gastric contents. And what is in the gastric region, guys, is the acid, the hydrogen. So when you remove more hydrogen by vomiting, so the hydrogens comes out, it means you're going to be less acidic. Okay, when you become less acidic, that is alkalosis. Another activity that can lead to alkalosis is functioning of the NG tube, and this leads to removal of hydrogen ions from the stomach, and this contributes to metabolic alkalosis. What about respiratory acidosis? Well, when you have acidosis, it means maybe the gas or the hydrogen ions are there in plenty. And what can cause what works in the respiratory, what is associated with the respiratory system? It's carbon dioxide, guys. So here carbon dioxide is being retained. And what can cause that? Maybe if you have a low or a slowed respiratory rate, it means more carbon dioxide will be retained because less is being exhaled. Less is being exhaled, more is being retained. The other conditions that can lead to more retention of carbon dioxide in the body, we have a mnemonic carbon dioxide. So we have COPD, asthma, respiratory depression, brain injury, obstruction of the airways, neuromuscular disorders, drug overdose, infections affecting the respiratory, obesity, extreme anxiety. All these causes will lead to less CO2 being exhaled. So more CO2 will be retained, contributing to respiratory acidosis. What about respiratory alkalosis? Alkalosis. It means the CO2 has done what? Has been removed completely. So there's no base. Okay. So, and this happens when you have a faster respiratory rate, especially when you are hyperventilating, panting like a dog. You are likely to result into respiratory alkalosis, or breathing through into a bag. You are predisposing your body into respiratory alkalosis. So hyperventilation is the main cause of alkalosis. Remember, lungs and kidneys will always try to compensate each other. So when you have too much acidosis in our body, it means the body will start hyperventilating, increasing that so that they can be able to remove that carbon dioxide. Remember, too much alcoholism, patient to breathe slowly in a paper bag, that can also contribute to that. Okay, patients breathing in a paper bag can also lead to alkalosis. Okay, so in calculating the ABGs, we normally, of course, we have several methods. We could have the ROM method, we have the tic-tac method, but we prefer the matching band method in evaluating ABGs because it's much elaborate and better and easier for most of us. So the matching band suite in an ABG figure normally has 3 rows and six buttons. So on the left of each one, we have the ABGs, the ABA, and the A stands for acidosis and B stands for alkalosis. And you can be able to see here, guys. So the first row, we have the organ, we have the pH, we have the 7.5, 7.45. We have diagram for the lung, we have the partial pressure of oxygen, then we have the kidneys, and then we have the hydrogen carbonate. Remember, we put pH as number 1 because pH it's primary. This is the primary factor that we are going to use. Then partial pressure of oxygen will be indicated as second in the second row, guys. And you can see 2 is there on the partial pressure of carbon dioxide, should be able to help. And hydrogen carbonate comes in third, and the 3 on the hydrogen carbonate should be able to help. So when the normal range is 7.35 to 7.45. So when it's 7.35 is an acid, when it's 7.45 and above, it is basic or an alkaline. All right. When the partial pressure of oxygen is 35 or less than 35, that will be basic. When the value is above 45, that will be acidosis. Equally for the hydrogen carbonate, when the value is below 22, that will be acidosis, while when the value is above 26, that will be alkaline. Okay, so we'll be matching. Okay, so we'll be matching the pH with the partial pressure of carbon dioxide and the hydrogen carbonate. Whatever matches, that will be the trick, guys. Okay, so the steps that we're going to use to interpret, number 1 is you're going to identify whether the acid base status, whether it is acidosis or alkalosis. And in this case, we will simply look at the pH. Okay, we look at the pH. If it is 7.35 or below, that is acidosis. If it is 7.45 or above, that is alkaline. All right. The second option, you are going to match with the partner so as to identify the primary disorder. Okay. And then lastly, we will determine whether it is compensated or uncompensated. Guys, when you say uncompensated acid-base balance, we are saying that the body is not fully able to correct the pH balance. The primary disorder will be present, but the compensatory mechanism have not yet had time to bring about the pH back to normal. So uncompensated respiratory, you will be expecting to have elevated CO2 values with low pH, while uncompensated metabolic alkalosis, you will be expecting to have excessive bicarb levels with high pH. So remember here, we have unfriendly friend here who does not care about what happens to the colleague. For example, look at this one, pH 7.24, partial pressure of carbon dioxide 56, hydrogen bicarbonate, the bicarbs, that is 24. So the first step we said we are going to do what? The first step is we look at the pH, the primary. This is our primary. So the pH here is 7.24. So this 7.24 is way below the lower limit of the normal pH ranges. The lower limit is normally 7.35. So that means, therefore, the situation at hand is likely to be acidosis. Okay? Because it is 7.3, 7.25, way below 7.35, the lower range of the normal range, which is 7.35 to 7.45. So this is acidosis. So after identifying that this one is an acidosis situation, you now go to the primary disorder, by matching with the partner. So you look at it, you say the pH is acidosis, but then look at the CO2. CO2 is 56. The normal range for partial pressure of carbon dioxide is 35 to 45. You can see 56 is way above 45. And we said if the value is 45 or above, that is acidic. So you can see, guys, this one is matching. Okay, it's matching. So this one will be a respiratory acidosis, guys. Respiratory acidosis, because 56 is way above 45, which is acidic. Okay, so it's matching, the pH is matching with acidosis, so it is respiratory acidosis. Okay, step number 3, we have to determine if it is compensated or uncompensated. We simply look at the pH again. Is it within the normal range? 7.24. The normal range is 7.35 to 7.45. So this one is outside the normal range. So that means, that's why we are saying it is uncompensated. If it was within the normal range, then we could talk of compensation. Okay, so the final response for this kind, or description for this kind of situation with a pH of 7.24, partial pressure of carbon dioxide 56, and the bicarbs 24, the correct description is respiratory acidosis and compensated. Okay, guys, let's look at this other example here. We have a pH of 7.56. Partial pressure of carbon dioxide is 26, and bicarbs is 22. So the first step is we look at the pH, which is our primary factor here. So 7.56, you can find this one is way above the 7.5, which is alkaline. So this condition we are saying is an alkalosis. Step number 2, we look at the pH to try and match it with the two values, or either the partial pressure of carbon dioxide or the hydrogen carbonate in this case. So in this case, you find that the partial pressure of carbon dioxide is way below the 35. Remember, the normal range for the partial pressure of carbon dioxide is 35 to 45. But in this case, we have 26. So that is way below the 35, and we say 35 and below is alkalosis. So you can see alkalosis for the lungs and the pH, they are matching, so that we say the problem is the lungs. So this respiratory alkalosis. But guys, look at the bicarbs. The bicarbs, is it within the normal range? Yes, within the normal range. It's not interested. This is what we call unfriendly guy. Okay, unfriendly colleague. He's not concerned with whatever is happening with the partial pressure of carbon dioxide. For him, it's just okay, within the normal range, not interested. Okay, let's look at now step 3, compensated or uncompensated. We again simply look at the pH. Is it within the normal range? If it's within the normal range, compensated. If it's outside, uncompensated. Look at 7.56, it is outside the normal range. So that means it is uncompensated. So the final description for this case will be respiratory alkalosis and compensated. Guys, you can have more examples in the description section. We have a link for the quiz. You can access and do more practice on the same. Okay, let me give you another example here also. What about a pH of 7.22, partial pressure of 39, and bicarbs of 18? First step, we said we do what? We look at the primary factor, which is the pH. So our pH is 7.222. Okay, so is it within the normal range? No, it's outside, but it's closer to the 7.35, which is acidic. So it's way below 7.6, which is acidic. So this is an acidic environment, okay, based on the pH. Okay, it's closer to 7.35, which you said it's acidic. Remember, 7.45 is an alkaline. Okay, so go to step number 2. We try to match the pH with either the partial pressure of carbon dioxide or the hydrogen, not the hydrogen, but the bicarbs. Okay, so look at it now. Oh, the partial pressure of carbon dioxide is 39. What is the normal range for partial pressure of carbon dioxide? Is 35 to 45. So it's not affected, guys. It's not affected. It's within the normal range. So we have to compare. So the pH, we have to compare it with the bicarb. Look at the bicarb, 18. The normal range is 22 to 26, guys. So this is way below. And we said anything closer to 22, that is acidic, anything closer or above 26, that is alkaline. So this one is closer to 22, that is acidic. So you can see the pH is matching with the kidney, okay, the metabolic. So that's why we are talking about metabolic acidosis. Metabolic acidosis, okay. Remember, we said we looked at the CO2, it is within normal range, it's not interested. So it's not a good friend here, guys. Looking at step number 3, whether it's compensated or uncompensated. Again, we simply look at the pH. Is it within the normal range, which is 7.35 to 7.45? No, it's not. So this is uncompensated. That's why the final description for this case is metabolic acidosis uncompensated. So guys, sometimes when it's compensated, it can either be partially compensated or fully compensated. When you start with partially compensated, you're saying that the body attempts to correct the primary disorder, but the pH will still be outside the normal range. Okay, will still be outside the normal range. So pH is abnormal and this is work in progress. Let's look at the pH 7.31, partial pressure 56, the bicarbs 41. So we start the step 1, we look at the pH, okay? Is it within the normal range? No. Where is it inclined? Guys, this one is closer to 7.35, which is acidic. So this one is an acidic environment. Okay? Okay, so next thing we want to see whether it is related to the lungs, which is respiratory, or the kidneys, which is metabolic. So let's see where the problem is. We start with the second one, of course, is partial pressure of carbon dioxide 56. The normal range is 35 to 45. So you can see this one is way above 45. So that means way above 45. And closer to 45, we say that is what? Acidic. And this one is acidic. The pH is acidic. So the pH is matching with the lungs. So that's why we say this one is what? Respiratory acidosis. So this step number 3, we want to determine whether it's compensated or uncompensated. Okay? Okay, so we simply look at the pH. Okay? Looking at the pH, you can see it is outside. So this is uncompensated. But let's look at the friend. Is the friend supporting or the friend is not interested? Okay, the friend is the bicarbs here. So the bicarb here is 41. What is the normal range for bicarb? 22 to 26. So it means the friend is assisting. He's not just there. He's assisting. Okay? Although when you look at the pH, it's still outside. So that's why we say this one is respiratory acidosis partially partially compensated. Okay, guys? Did you get that? Respiratory acidosis partially compensated. Okay, guys, I can add you another example here. Here we have a pH of 7.55, partial pressure of 48, and bicarb of 36. So we start step number 1, look at the pH. Is it acidosis or alkalosis? You can see this one is way above the 7.45, which is alkalosis. Okay, so this is an alkaline environment. Next, we want to know if that's alkaline environment, is it being caused by the lungs, that is respiratory, or the kidneys, which is metabolic. Okay, which one is outside the normal range? You can see this is 48, so 48, this is the normal range is 35 to 45, so slightly outside, okay, slightly outside, and slightly outside. And what about the bicarb? Here it's 36, and the normal range is 22 to 26. So guys, here it will be a metabolic. That is, the problem is coming from the kidney. It's a metabolic alkalosis. Metabolic alkalosis. Lastly, we want to determine whether it's compensated, uncompensated, and partially or fully. So first of all, we are saying that it is uncompensated because the pH is not normal, it's not within the normal range, so it's uncompensated. Okay, so is it partially or fully? Okay, it is it's not fully because the pH is outside the normal, so it's not fully, but it is partially because the friend who is the partial pressure of carbon dioxide is outside the normal range. Okay, is above it's supposed to be 35 to 45, but it's 48, so is attempting to assist. So that's why we are saying this one is metabolic alkalosis, partially compensated. When is something fully compensated? It is fully compensated when the body has successfully corrected the primary disorders so that the pH is back within the normal range. However, the compensatory mechanism may result in abnormal level of the other components, either the partial pressure of carbon dioxide or the bicarbonate. Okay? Example here, guys. Look at this one. pH 7.37, partial pressure 52, the bicarbs 31. Okay, so looking at the pH, is it acidic or alkaline? Well, this is 7.37 is within the normal range, which is 7.35 to 7.45. So what am I supposed to do in this case, guys? But if you look at 7.37, it's much closer to the 7.35. So that means it is acidic. Okay, it's acidic here, guys. Okay, so if it's acidic, we have to look at it. What is it matching with the partial pressure of carbon dioxide? Partial pressure of carbon dioxide is 52. That is way above 45, which is an acid. So it matches. So this is a respiratory acidosis. Respiratory acidosis. Guys, remember that the pH is within the normal range, so it is fully compensated. Okay, respiratory acidosis, fully compensated. All right, what about this one? 7.42, partial pressure of carbon dioxide, we have 42, and then the bicarbs 34. Okay, guys, this one we are saying the pH is within the normal range, but it's more closer to 7.45. So this is an alkaline environment. It's an alkaline environment. So does it match with the partial pressure of carbon dioxide? 42, it's more of 42, it's more of the acid, so it doesn't match with the 7.42. What about the bicarbs? 34. Yeah, this is alkaline. Okay, so the problem is metabolic. So this is metabolic alkalosis, fully compensated because the pH is within the normal, is within the normal range, guys. Okay, guys, we've come to the end of the session, but you can have this question, guys. Which is the best description for these values, where we have a pH of 7.4 of 7.56, partial pressure of carbon dioxide 20, and the bicarbs 20. Okay, guys. Step number one, look at the pH. Our pH is 7.56. You can see it's way above the 7.45, which is basic. So this is an alkalosis environment, an alkaline environment. Step number two, we look at the matching. Is this 7.45 at 7.56, which is an alkaline, matching with the partial pressure of carbon dioxide? Carbon dioxide is 20. Okay, remember the normal range is 35 to 45. 35 and below, alkaline, 45 and above, acidic. Okay, so this one we had an alkaline here, and here again at 20 we have an alkaline here, so it's matching. That's why we are saying the problem is the lungs. So this is respiratory alkalosis. So guys, we have to say, is it compensated? Not compensated. Look at the pH. Look at our pH. Look at our pH is outside the normal range. What about the friend? What about the friend, the bicarb? It is 20 and the normal range is 22 to 26. So it means this friend is attempting to help. Is attempting to help. So we can't say it's uncompensated. It's compensated. What all we want to know in this case, is it fully compensated or partially compensated? Because of the pH, it is outside the normal range. We are going to say that that is respiratory alkalosis partially compensated. Okay, not fully, partially compensated. Okay, guys, thank you so much for the presentation. Okay, and for your attendance. For being keen throughout the presentation, I'll urge you to look at the description section. You'll find a link for an quiz. You can attempt those quizzes and practice on them so as to perfect your skills on the interpretation of these the ABGs. Thank you so much and have a great time.